Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan, and here is what I bring to you from the world of medicine. That finds a strong association between prediabetes and heart attack risk. While diabetes is known to cause serious health conditions such as heart attacks, strokes, and even kidney problems, now the link between prediabetes and heart problems has not yet well been established. According to a new study that was presented at the ENDO 2022, which is the Endocrine Society's annual meeting, prediabetes appears to be a strong independent risk factor for heart attacks. The study serves as a wake-up to everyone to shift the focus to managing the prediabetics condition and not just diabetes. Based on the findings, the authors encourage everyone to make lifestyle changes, follow a healthy routine diet, and regularly exercise for at least 150 minutes each week in patients with prediabetes to decrease the risk of developing heart attacks. The researchers analyzed data from close to 1.79 million hospitalizations of patients who had a recent episode of heart attack. Of these patients, 1% had prediabetes. After adjusting the risk factors for heart disease, it was found that prediabetes was associated with 25% increased odds of a heart attack compared with patients without prediabetes condition. However, those with prediabetes also were at 45% increased odds for having a percutaneous intervention and almost doubling the risk of having a heart bypass surgery. The researchers hence concluded that their findings did reinforce the importance of early recognition by screening and early intervention of prediabetes by various lifestyle changes or even medications to decrease the risk of developing cardiovascular events. The safety of Covid19 vaccination for patients treated specifically for hypothyroidism. According to a new study being presented at the ENDO 2022, the Endocrine Society's annual meeting, it has been found that the inactivated as well as the mRNA Covid-19 vaccines both appear to be safe for patients who have been treated for hypothyroidism. The study found that these vaccines do not cause significant fluctuations in the thyroid function and are also not associated with an increased risk of emergency department visits or even unscheduled hospitalizations. No previous studies have looked at any possible relationship between COVID-19 vaccines and unstable thyroid function control among patients receiving a thyroid hormone replacement for hypothyroidism. They added that their reassuring findings should encourage patients treated for hypothyroidism to get vaccinated against COVID-19 for protection from potentially worse COVID-19 related outcomes. The study evaluated an inactivated vaccine called the CoronaVac and an mRNA vaccine, which is Pfizer-BioNTech vaccine. The researchers evaluated data from more than 47,000 COVID-19 vaccine recipients taking levothyroxine for their hypothyroidism condition. The patients were divided into three groups. Firstly was the unvaccinated ones. Those who received the corona vaccine were the second, and those who received the mRNA vaccine were the third group. Patients who received either type of COVID-19 vaccine were not at increased risk of needing to have their levothyroxine dosage reduced or rather increased. However, COVID-19 vaccination was not associated with a higher risk of emergency department visits or even unscheduled hospitalizations. AI helps in the identification of benign thyroid nodules, thereby leading to a reduction of unnecessary biopsies. Artificial intelligence can be used to identify thyroid nodules seen on a thyroid ultrasound routinely that are very unlikely to be cancerous in nature, reducing a large number of unnecessary biopsies. In this new study, the researchers used machine learning, which is a type of an AI, to analyze the ultrasound images of thyroid nodules. Machine learning is the process of using mathematical models of data to help a computer learn about anything without direct instruction. More than 30,000 images from 621 thyroid nodules were used to train the machine learning model that classifies the thyroid nodules into two types, either as a cancer or a no cancer. The model was tested on a different set of 145 nodules collected at another healthcare system. The AI-based model achieved a sensitivity of 97% and a specificity of 61%. The authors believe that this is definitely a good next step to improving patient care and avoiding unnecessary procedures. The researchers therefore demonstrated that using the AI analysis of ultrasound images to rule out thyroid cancer and avoid unnecessary biopsy is definitely possible. They remarked that this technology could assist radiologists and endocrinologists in choosing which thyroid nodules should undergo biopsy, especially those in the community who may not review a large number of thyroid ultrasound images. Empagliflozin, which may decrease the risk of kidney stones in people with diabetes. We all know that empagliflozin is the drug used along with diet and exercise, and sometimes with various other medications to lower your blood sugar levels in people having type 2 diabetes. It has also been used to reduce the risk of stroke, heart attack, or even death in people who have type 2 diabetes, along with heart and blood vessel disease. Also, empagliflozin is used in adults with heart failure to reduce the risk of needing to be hospitalized and also death due to heart and blood vessel disease. Now, this diabetes drug has been found to even decrease the risk of kidney stones in patients with type 2 diabetes. The researchers used existing data from 20 randomized clinical trials to evaluate whether empagliflozin reduced the risk of kidney stones, and they pooled the data from close to 15,000 people who had type 2 diabetes. Of these, around 10,177 received empagliflozin and the remaining were in the placebo group. Patients took either empagliflozin or a placebo for about 1.5 years. The results of the study showed that when compared with placebo, treatment with empagliflozin was associated with an approximate 40% reduced risk of kidney stones in type 2 diabetes. While the precise mechanism is still not known or rather unclear, the findings did mean that empagliflozin may be used to prevent kidney stones in individuals with type 2 diabetes. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.